Hello, and welcome to My Brain Matters, where we dive deep into the brainy side of health and wellness. I'm your host, Stephanie, and today we're exploring a topic that's both fascinating and a little bit sci-fi: green light therapy for migraine pain mitigation. That's right, folks, we're not talking about green smoothies or green living today, but actual green light. So grab your sunglasses and let's shed some light on this intriguing subject. Now, if you're like me, you might be thinking, green light therapy? Sounds like something out of a superhero movie. But believe it or not, recent studies suggest that exposure to a certain wavelength of green light could reduce migraine pain. It's like giving the green light to relief, and who wouldn't want that? But before we get too excited, let's take a step back and examine the evidence. One study published in the journal Cephalalgia found that participants who were exposed to green light experienced less migraine pain compared to those exposed to white light. It's like the brain has a soft spot for the color green, at least when it comes to migraines. Now, you might be wondering how this green light magic works. Well, it's believed that green light affects certain cells in the eye that are connected to the part of the brain that processes pain. It's like these cells see the green light and say, hey, let's take it easy on the pain today. But as with any new treatment, there are skeptics. Some experts argue that more research is needed to fully understand the benefits and limitations of green light therapy. It's like we're at a green light, but we're not sure if it's time to go full speed ahead or proceed with caution. And let's not forget about accessibility. Not everyone has access to green light therapy devices, and they can be pricey. It's like having a VIP pass to pain relief that not everyone can afford. Now that we've illuminated the potential of green light therapy, let's dive into the nuts and bolts of how to actually do it. If you're considering giving this a go, there are a few key parameters you'll want to follow to ensure you're getting the most out of your green light experience. First up, you'll want to make sure you're using a light source that emits green light at a wavelength of around 520 nanometers. This specific wavelength is the sweet spot that's been shown to have potential benefits for migraine relief. Next, it's crucial to create the right environment for your therapy. This means turning off all other light sources in the room. You're going for a green light oasis here, folks. No competing wavelengths allowed. Now, let's talk duration. While even 30 minutes of exposure can provide some relief, the optimal results in studies were seen at the 1 to 2 hours a day mark. It's like marinating your brain in green light. The longer, the better. But where should this green light be exactly? You'll want the light source to be in your frame of vision, but not directly shining into your eyes. Think of it as a gentle green glow bathing the room, not a green laser pointer aimed at your eyeballs. And what should you do during this green light therapy? Participants in studies were encouraged to engage in activities like reading or practicing mindfulness, while keeping their eyes open during their daily therapy. It's like multitasking for your brain health, soaking up the green light while also feeding your mind. So there you have it, a step-by-step guide to trying green light therapy for migraine relief. Just remember, while the green light is promising, it's always best to consult with your healthcare provider before starting any new treatment. That wraps up our segment on how to do green light therapy. If you decide to give it a try, we'd love to hear about your experience. Did you find it helpful? Did you discover a newfound love for the color green? Let us know. Until next time, keep exploring new ways to support your well-being and stay open to the possibilities of the light spectrum.